Giving solid foods safely. Many parents look forward to starting solids with their baby. It can feel like a real milestone and it can be fun. Babies don't need solid foods until 6 months of age and shouldn't get them before 4 months of age. In some circumstances, doctors may tell parents to thicken formula with infant cereal, but that's the only time a baby might get solid food before 4 months of age and should only be done under a doctor's supervision. It's also the only time that solids should be mixed in the bottle. In general, we don't recommend doing that. You and your child's doctor will decide when your baby is ready for solid foods. Here are some signs that your baby might be ready. Your baby has good head control. Your baby needs to be able to hold their head upright for the whole feed. While most babies get good head control around 4 months, it can take some babies a bit longer. Your baby can sit upright comfortably. They don't have to sit independently. Most babies won't do that until 6 to 7 months of age, but they should have the strength and stamina to hold their trunk upright in a chair and not slump. Your baby can eat and swallow foods comfortably. To check this out, you will need to try it out with some puree or baby cereal on a spoon. If your baby pushes it away with his or her tongue, or swishes it around in their mouth instead of swallowing it, your baby likely needs a bit more time. If your baby needs more time, just put away the spoon and try again in a week or so. If your baby is more than 6 months old and you keep running into trouble, let your doctor know. Once your baby is ready, talk to your doctor about which foods to try first and how to try them. This is particularly true if your baby has eczema or there is a family history of food allergy. At the beginning, it's a good idea to try one new food at a time and watch for any reactions, not just allergic reactions, but diarrhea, constipation, or fussiness. Check with your doctor about how long you should wait in between new foods. Some families start solids using an approach called baby-led weaning. In this approach, you skip the spoon and wait until babies are ready to pick up foods and feed themselves. If you are interested in doing this, talk to your doctor for specific advice. As babies are learning to eat solid foods, it's important not to give them anything they might choke on. Babies can sputter and choke with almost anything, which is why it is important to always watch your baby closely as they eat. But some foods are more likely to cause problems, such as anything that has hard chunks or could break off into hard chunks, like cookies, hard pretzels, partially cooked vegetables, or fruits with pits. Some foods, purees, or foods that dissolve easily in the mouth, are better first foods. Anything that could get stuck in a baby's windpipe, like a grape, carrot rounds, or a slice of a hot dog. Foods like these should be broken into little pieces. Anything with bones. No chicken wings for baby. Because babies need to learn how to eat, it's good to start with purees or very soft dissolvable foods and gradually work to foods with soft pieces, like overcooked pasta, and then try things like shredded meat. This gives your baby a chance to get used to chewing and swallowing different textures. Even though your baby may not have teeth, babies do a good job of chewing their food with just their gums. Wait until your baby is completely comfortable with one texture before trying another. If you feel like you are stuck and can't move forward to different textures, talk to your doctor. Make sure you and your baby are sitting comfortably and that your baby is secure in a high chair or baby seat. You can feed your baby on your lap, but a high chair or baby seat allows you to better watch your baby's face during eating, which is safer. Never feed your baby solids while they are lying down. If your baby starts to cough or choke while feeding, stop and be sure they settle before continuing to feed. If they keep coughing or stop coughing but look pale or blue or lose consciousness, call 911 right away. It's not a bad idea to learn some infant CPR skills. Check with your doctor or local hospital about available classes. If you are careful about when and what you feed your baby, chances are everything will be fine. Thank you for watching this video on keeping babies safe.